Hi, it's Dr. B with Brain Bites. So today I'm going to talk to you about generic medications and why I often choose these over new medications. So, when I first am choosing medications, the things I'm going to think about is what I'm going to do to match the right treatment to a certain patient. So, some of the things that I'm going to look at when I'm trying to match that correctly is what are the symptoms that the patient's experiencing? What diagnosis do they fall into? What am I trying to treat overall? Do they have any other medical problems? Do they take any other medications? Do I have to worry about drug-drug interactions? What's their past medication history? Have they had good results with other psych medications or have they struggled with a lot of side effects? And then I want to consider the potential side effects and how they might affect this patient, their treatment, and any other medical problems that they're going through. So, one of the really great things about generic medications is that we have a lot of information on them. We know a lot about generic medications because they've been around for years, sometimes even decades. Over that time, we get a lot more data. So, there are a lot more research studies that come out. We have a lot more research to look at about these medications. There's a lot more experience with just prescribing these medications, whether it's my own personal experience prescribing them to my patients, or it's colleagues or other people publishing the data when they prescribe these medications, case reports, that sort of thing. And then we tend to see more information about the long-term effects. If something doesn't have problems until a patient has been on it for 5 or 10 years, we won't know that right from the beginning when the drug gets approved initially. So after that happens, after a period of time, if there are problems, the FDA will likely pull that medication. But if not, we have years and years of data to look at for what are the long-term effects. Do we have metabolic risks? Do people gain weight over time? Can it affect cognitive function? Or do patients tend to get used to the medication after a few years and it's no longer effective? This is all important stuff that we tend to have a pretty good handle on by the time we're prescribing generic medications because of the amount of time that they've been available to us. So, new medications can be awesome. Like, there's a lot of great stuff out there. Everybody has seen the commercials about things. I don't know about therapists, but psychiatrists get tons of pop ups all the time on all of the resources that we use where it'll say, oh, click on this to find out about this new medication. And that's how we get a lot of the information. Now, that's not the only way we get the information. Sometimes our journals will include articles about medications that are in the FDA process of being tested or medications that have been tested in other countries and haven't been approved here yet. Sometimes they're just talking about new novel medication actions, and so we'll be finding out about new medications that are coming down the pipeline. The main source, though, is marketing. So there are salespeople that work for these pharma companies that market to people who are going to prescribe. So we may get invited to dinners. Drug reps go to like physical locations. I'm a virtual provider, but I do have people reach out sometimes and try to buy me breakfast. But they'll go to an office and they will, bring the staff some food and then they will give a presentation about this new medication. There are also webinars that you can sign up for and be presented to. Sometimes when you go to a conference, they will have somebody there live who's presenting on one of the new medications. And that's nice too, because oftentimes that's a physician and you can ask that person physiologic questions. So these new medications have a lot of marketing behind them, but we don't necessarily have a lot to go on. Studies that are done on these new medications have a very specific population that they do this research on. So a lot of people get excluded for being on multiple medications or having other medical complications. Sometimes they're excluded for having multiple mental health diagnoses. So it's a very thin slice of the population. And we all know we have patients from all walks of life. So we have patients with different medical backgrounds, different genetic backgrounds. And this kind of information is important to keep in mind because the study's on this tiny slice of the population. And it's more likely than not that my patient is not going to fit into that little slice. So these new medications can be really hard to determine how it's going to work on regular people. So the people that I see in my clinic, the people that didn't go into the study and probably would have been excluded for one of those reasons I already mentioned. So In general, other than in conferences, most of these presentations about a new medication don't come from medical doctors, physicians. Most of these come from salespeople, which is fine. Salespeople can give lots of great information on the medications. But a lot of the details that I'm looking for when I want to start a new medication on one of my patients are very specific. They are very specific about the physiology of how the medication works. They're specific about drug-drug interactions. How is this going to interact with the patient's medications that they've been taking? Or do I have to get them off of certain medications because there is a strong known drug-drug interaction? And what do I do if I'm not sure and there's no data in the study to show? So the salespeople might know the material, but they don't always know the science behind it. And then there's the extra layer of complication where patients see the commercials. They see them on TV or wherever they're getting their information from, and they say, oh, that's a new medication. That sounds like me that they're talking about. I'd love to try that medication. So there's the pressure of the patient coming to us saying, I want this new thing. It's supposed to be better. Will you please prescribe it to me? It's hard to explain that I don't really know much more about that medication than they do, and I'm not sure that it's going to be a good choice for them. It feels risky to try something I don't have experience with and that there's not a lot of data to work with. We had a lot of old medications that promised that this is awesome, it's the new best thing, everyone's going to be able to benefit from this. And then they have to be pulled from the market a few years later because it didn't perform as expected, either in real life with real patients, it caused long-term risks, or maybe it didn't provide the positive effects that it was touted to do. Like before, I don't fully trust salespeople for pharma that can't explain all the physiology behind the medications or the potential side effects. There are significant limits to who's approved to use the medications based on the FDA data. So based on those studies that were done with this slice of the population, oftentimes there are very narrow guidelines for what the medication is approved to be prescribed for. It doesn't mean I can't prescribe it for what I think is appropriate use of the medication. But if the FDA doesn't approve it for that reason, then insurance oftentimes won't pay for it, which is a problem because these medications can be very, very expensive. So insurance doesn't usually pay for the off-label use of the medication, and they often won't pay for new medications at all, or only after a patient has been through a series of trials of the older medications to show that none of those work for some reason and that this new medication is actually warranted. Also, patients are often provided samples. So I don't get samples because I'm virtual. So drug reps don't come to see me and say, here is your monthly supply of samples so that you can hand these out to your patients. And I don't want my patients to have to rely on samples that come from a drug rep. What if the drug rep is on vacation and the patient needs refills? What if they lost one of their blister packs and they don't have the next set of medication? What if there's some other complication and they can't get the medication? They can't just call the pharmacy and say, I need a refill on this thing. It costs $1,200 to fill it, and they're used to getting it for free from the clinic. I just don't really feel comfortable with that being the supply for my patient, especially if it's something we're talking about with depression where the side effect of not having the medication, the risk of not having that medication could be suicidality. That would be terrible. To me, that risk is not worth it. And I also don't want my patients to feel like they have to pay out of pocket for a medication that may not even be better than a generic medication, something that's very inexpensive or that their insurance would pay for. Now, that's not to say that new medications don't have a place. They certainly do. And as I work with them, I gain my own personal knowledge and experience using them, who they're best for, what kind of side effects I see most often, and what to expect as far as ideal outcomes. The best consideration for when to use one of these newer medications is if somebody really struggles with significant side effects with the current class of medication. And this medication is saying that they have a better side effect profile. So if a patient has a limited effect from a medication within a certain class, and this medication offers a different mechanism of action, that also may mean that this patient could benefit from it if it works in a different way. And a good candidate for insurance paying or no issues with paying out of pocket would also be somebody who I would consider a new medication for. So this is just a bit of what I think about when I'm starting someone on a medication and whether or not it should be an old one or a new one. This is an ongoing discussion with my patients too, of course. If you downloaded my list of the top 10 meds that I prescribe, you'll see that they're all generics, and I expect it'll stay that way for a long time. So if clients come to you asking about a new medication that they saw on TV, that's great. But it also may be helpful for expectation management to remind them of all the data that's already available for older medications, how we understand more about them, and how they're easier to afford. There are a lot of oldies but goodies out there, and a lot of good reasons why I still prescribe them. I hope you enjoyed today's brain bite and can see where I'm coming from when I prescribe generic meds over the newbies. Enjoy.